Hello, I'm Dr. Gary Arthur, and since there's nobody in the lobby right now, I'm going to take my mask off so I can actually talk. I really wanted to share some great news with you. Could you use a little good news? Science has good news for us. We wanted to do a research study review of what chiropractic actually does for our immune system, and we've got so many different entries. I just want to go through a little science, because sometimes we need science to really understand and feel good, like the platform we stand on is solid and it's true. And so I wanted to just share some things with you. In 2011, the Journal of Osteopathic Association found that spinal adjustments increases your IgA by 139%, which increases your immunity, decreases the risks of infections. Now, IgA is a specific immune system protein that's vital for immune function. In 2010, there was a study in the Chiropractic and Osteopathy Journal. Those who received an adjustment had significantly higher IgG and IgM levels post-adjustment compared to the control groups. So these markers significantly increase immunity. It also showed that patients who received chiropractic adjustments showed increased levels of interleukin-2, which regulates the activities of white blood cells. So interleukin-2 is a buzzword in immunology these days because they realize how important it is. Also, in 2014, researchers at the University of Madrid Medical School, they found a direct link between chiropractic adjustments and the immune system. They found that adjustments actually trigger an increase in neurotensin, oxytocin, and cortisol blood levels. All of these have a direct beneficial effect on immune modulation and regulation. And then also we have another one, Dr. Ronald Perot, PhD, Chief of Cancer Prevention Research at New York's Preventive Medicine Institute. He found that chiropractic patients had 200% greater immune competence than people who had not been receiving chiropractic care. So pretty amazing. Now, one of the ways that chiropractic actually got onto the map was back in 1917. There was the Spanish flu epidemic, and they found that people who got adjustments in chiropractic care had much higher survival rate than those under just medical care. So for example, in Davenport, Iowa, there was a 5.5% death rate under medical care, but a 0.06% death rate under chiropractic care. In the state of Iowa, it was a 6.5% death rate under medical care, but a 0.12% death rate under chiropractic care. And they also had another thing where there were many cases that were given up on as beyond hope. And so the same epidemic report shows that chiropractors in Oklahoma treated 3,490 cases of influenza with only 7 deaths. There was also a record showing that chiropractors were called in 233 cases where medical doctors had cared for the patients and had finally given up on them as lost. The chiropractors saved all those lost cases except for 25. So the research is there, the science is there, getting adjusted. The Chinese have been doing this for over 3,000 years. We know what happens. The body decreases pain, the immune system comes up. We are still delivering essential health care to people that are in pain to unburden the medical system right now during this time. I'll be putting my mask right back on to take care of some patients. We're still open Tuesday, Wednesday, and Thursday during this time, and be good to help you if we can. If you're in pain, you're concerned, we're here for you. Thank you very much. I'm Dr. Gary Arthur, DC, ND, here in downtown Laguna since 1987. Thank you.